Welcome to the PLAB 2 Preparation Tips series, doctors. Today, we will be discussing a crucial topic, depression. Understanding how to assess depression is key for your success in the PLAB 2 exam. We will break it down step by step to help you prepare. What is depression? Depression is a common mental health condition that affects mood, thoughts, and physical well-being. It has both biological and cognitive symptoms. When discussing depression with patients, it's helpful to explain that it impacts both the mind and body. A good phrase to use is, depression can cause physical changes like tiredness or loss of appetite, as well as mental effects such as feeling down or worthless. Let's start with the biological symptoms. These include physical changes such as sleep disturbances, appetite changes, and fatigue. When gathering data, you might ask the patient, "How have you been sleeping lately?" Or, "Have you noticed any changes in your energy levels?" These questions help explore the patient's physical well-being. Next, we explore more biological symptoms. Ask about psychomotor changes, like, "Have you felt unusually restless or sluggish?" For fatigue, do you often feel tired even after a good night's sleep? These questions will guide you through the data gathering process effectively. When assessing sleep disturbances, a simple question is, "How have you been sleeping lately?" To dive deeper, you might ask, "Do you struggle to fall asleep or wake up frequently?" It's important to gauge the severity of the symptoms from mild to severe based on the patient's response. For example, if they mention occasional trouble sleeping, you can document it as mild. When assessing appetite and weight changes, use questions like, "Have you noticed any changes in your appetite?" Or, "Have you lost or gained weight without trying?" This helps you evaluate the extent of these symptoms. Again, categorize the severity. Mild changes in appetite versus significant weight loss or gain. Now, let's talk about cognitive symptoms, starting with poor concentration and indecisiveness. You could ask, "Do you find it hard to focus on tasks or make decisions?" For feelings of worthlessness, ask, "Have you been feeling down on yourself or guilty about things?" These questions will help you gather important cognitive information from the patient. When discussing hopelessness and suicidal ideation, ask the patient, "Do you feel like nothing will improve?" Or, "Have you had thoughts of harming yourself or ending your life?" It's essential to handle these questions with care, showing empathy and concern throughout. When assessing cognitive symptoms like concentration and decision-making, ask questions such as, "Are you finding it difficult to concentrate on simple tasks?" And remember to evaluate how often this happens. Is it occasional or persistent? To assess feelings of worthlessness or guilt, ask, "Do you often feel like you're not good enough?" Or, "Do you feel guilty about things that you can't control?" This will help you gauge the severity of their emotional state. To assess hopelessness and helplessness, ask, "Do you feel like there's no hope for the future?" Or, "Do you feel like you can't change your situation?" It's important to address the severity of these feelings to create an appropriate management plan. When addressing suicidal ideation, ask, "Have you had thoughts that life isn't worth living?" Or are you thinking about harming yourself? Be sure to assess whether these thoughts are fleeting or more frequent, and whether there is any specific plan involved. Showing empathy by saying, "I'm here to support you, and we'll work through this together," can be very reassuring for patients in distress. This concludes our overview of assessing depression in the PLAB 2 exam. By practicing these questions and responses, you'll build confidence and be better equipped to manage depression stations effectively. Thank you for joining, and keep up the great work in your preparation. Please like and subscribe to Turingmedschool. Good luck with your preparation.